Welcome back, everyone. We have another inspiring story here. We have Christy from San Jose, outside Silicon Valley. Hey, how you doing, Christy?
I'm doing well. How are you?
Good. Just
Great.
one of the most exciting days of the year for me to put this podcast together with over 12 survivors. So thank you so much for coming aboard here, part of our family for Think Pink Tuesday. And I can't wait to hear your stories. So tell you what, let's just deep dive into it. Give us the A, I always say the A to Z about from the beginning to the end, and we'll just chat about it.
From the beginning to the end. Okay. Well, for me, the beginning started about 8 years ago. That's when I was diagnosed. I was 38 at the time, and I was actually getting ready to go for my second child when my midwife is the one who discovered the lump. And from there, instead of moving on to a second pregnancy, I moved on to breast cancer. So that was, how it was discovered. At the time I was diagnosed, I was found to be stage 3C after my surgery, which meant that I had more than 3 lymph nodes affected. They went in for 2 smaller tumors and ended up finding 3, the largest of which was 8 centimeters, the actually third undetected one, which for me is always a little scary because I did get the mammogram, ultrasound, MRI, PET scan. Like I went through every possible diagnostic, and I did have dense breasts. So even with all of those, that 8 centimeter tumor still went undetected. So for me, that's, always a little alarming. I do have 2 sisters, and we have a strong family history of breast cancer. So, when they tell me, well, don't worry, we're getting monitored very closely, I can't help but go back to, my own experience of having been monitored, in all the different ways that are available, yet still having that huge tumor there, being missed. So, from there, I went on to chemotherapy. I had 4 rounds of AC and 4 rounds of Taxol. And then I believe it was 6.5 weeks of radiation, 33 treatments, whatever that was, every day. And at that point, I was pretty wrecked. I was dealing with a lot of anxiety at that point toward the end of my treatment. So that was a really dark time for me, especially after. I think like a lot of people think, oh, getting through treatment is the worst part. But I found, it was the letdown after when I didn't have that focus on me and, all the doctor's visits to know, we're doing what we can, we're here, we're attacking it, once everything stopped. And I was just kind of on my own, waiting with bated breath to, just what was going to happen next. Did it work? Did it not work? And I think that's something that all survivors, live with once we go through, knowing that 1 in 3 of us will be re-diagnosed. It's hard to, move forward without that cloud on your shoulder. Just, when is it? When is it? Is it? And for me, I would say that fear was finally going away around the 7-year mark, because my oncologist would always say, well, let's get to 4 or 5 years. After that, your chance of being re-diagnosed is going to go down. So I think once I got to that 4 to 5 year, I felt a little more comfortable, but still, just knowing that really it can come back at any time, 10, 15, 20 years later. I don't think I completely let that go. But for some reason, at the 7-year mark, I think I finally just felt like, I'm good. I'm done. It's been 7 years. I feel good. Nothing.
Yeah.
Nothing's gone wrong. And lo and behold, right after the 7-year mark, I was re-diagnosed.
Oh my.
So that was just last December. I was having a hard time breathing, and I went to my general practitioner who, satisfied my request of asking for a chest x-ray just because I was, pretty concerned, with having had breast cancer that, what if this is breast cancer? So we got that x-ray done, and I was found to have fluid building in the lining around my lungs, and they tested that fluid and found breast cancer cells in it. So last December, I had to go through chemo again, and that's why you see my short hair, but I'm actually getting used to it.
You're rocking it out real good. It's all good.
So I went through, again, 12 rounds of Taxol, starting last December into the springtime. And now my treatment's continuing with monthly injections of Faslodex. And I also am on an oral chemo that I take twice a day. And all of these are still hormone-targeted therapies. So I'll just continue with that, and, keeping fingers crossed that it will keep it at bay for as long as possible. And, I try to be hopeful. It's a lot to carry. I have a son.
I could imagine.
He just turned 11. So of course, I want to be around for him. I think about, okay, he has, so many years until high school, till college.
Mm-hmm.
But I think living with that reality of, not that maybe I won't see that, is hard. My oncologist says, we're putting you through treatment. This was when I was re-diagnosed. We're going to put you through treatment again, and you'll live for years and years, which could be 10 years. On the, I think, hopeful, really optimistic side. But, as I'm in the groups, I see a lot of women that have been metastatic for a long time, even longer than 10 years. And one good thing for me was that they didn't discover it anywhere else. So once that fluid was found, then I was put through, all the tests again, and they couldn't find it anywhere else. Of course, I'm researched enough to know that doesn't mean it's not there, but at least it's not to the point that something's actually visible. So it could be, something that we're able to maintain for hopefully quite a while going forward.
Wow, I can't imagine that. I got to ask you this, and this is like I tell everybody on every show is like, so 7 years, I mean, I think everybody out there that needs to know about this, they need to get tested on a regular basis. Am I right?
It's hard because as part of the standard protocol for treating breast cancer, they don't really do routine scans because they've found that that doesn't increase your prognosis, by continually scanning you. It exposes you to more radiation. And what they've found is that the patient is usually symptomatic by the time they can see something. So just, scanning you every 6 months to look for something that's probably not there is actually more dangerous and puts you at a risk for developing other cancers because of that radiation exposure. So they've found to just go by how the patient's feeling is actually just as effective. So, even the top institutions, in California where I am, so, those would be Stanford and UCSF. It's not part of their protocol to put women through routine scans just to monitor. And that makes a lot of people very nervous, once their treatment ends and they feel, naturally, no one's watching, what if it's growing? Why aren't they checking to see?
Exactly.
And, they've done a lot of studies that show it's not beneficial to the patient. And not only the things I mentioned, but they also find just the stress of getting scanned, waiting for that result. Oftentimes they find something else that needs to be investigated. Like one of my original scans when I was diagnosed found a spot on my liver. So then I had to go through another biopsy of my liver to find out what that was. All turned out to be nothing, But what often happens with these scans is there is something else seen that's worthy of being investigated. And then, that goes on. So that's been another factor that they've considered for the patient, is that stress of, ongoing tests that sometimes need more testing that turn out to be nothing. Is that beneficial to the patient? We know now that stress definitely does affect our health, our well-being. So they've kind of, weighed the pros and cons of doing that. And a lot of women also get a blood test. There's the CA 125. I hope I'm getting that number right. But it's a blood test that's a tumor marker. And that test, though, unfortunately, is also shown to have a lot of false positives. So they don't use that as well to determine treatment. A lot of oncologists, they will run it, but they can't base treatment decisions on that number, because it's kind of all over the place. It has a lot of false positives. It fluctuates without reason. So like my oncologist says, he says, I have a love-hate relationship with that test, and mostly I hate it. So he says it just, for him, his experience is it produces a lot of anxiety when the numbers are higher, and, outside of that, nothing's changing for the patient. They feel the same. Their scans look the same. So and then the next time he runs it, it might be, less, and it's just not consistent. So I think we really need to work toward finding a better test, a better blood test for breast cancer that is accurate, something we can rely on, that practitioners can use to, make treatment decisions, and that it's not just, this arbitrary test that we run, but it doesn't really necessarily tell us anything concrete.
So true. So you know what? I really now understand and grasp that, because I hear so many times, just go get tested. And now it's check your body out. If you feel like something's going on, then go get tested. Is that what you're pretty much saying? Pretty much don't get tested every 5-6 months or a year now.
Yeah, especially with scans. I mean, some people get the blood test every few months, but they should just know that those are not, reliable. So if their numbers, gone up, it's not, necessarily something to really latch onto. As I said, again, most institutions have a protocol that they cannot make decisions based on that result. Like I said, because it's so faulty.
Wow. That is good information. You know what? I learned so much just right now. You saying that, that's amazing stuff for everybody out there, our viewers, to just, to take in. And I guess the biggest thing is we just keep learning, and we keep getting research on all this.
Yeah. And I think, for me, it was that, feeling something, feeling that shortness of breath. And it's hard as survivors, every little pain, or, you automatically, my hip hurts. Oh, it's in my bones. It's, I think, very natural that every little kind of ailment or sore we, fear could be something. But when it's something, really off, I think just trust your instincts. Like when I was short of breath, and I could have just had a cold, I could have, had something going on, but something was just telling me, you need to, really go in and see what this is. So just trust, without being overly paranoid. I know it's a hard balance to find, but definitely stay vigilant where you can.
There it is, with the positive hope. So now let's talk about this group here. I'm going to bring this up real quick here. This is the Fierce Flat Forward. This is a group here that you have, and you already have almost, 5.6 thousand members. Tell me a little bit about that and what's going on with that.
Okay, so that group I started back in 2019. That happened when I was going to have my first revision surgery because I was really unhappy with my reconstruction. I was reconstructed with saline implants, and I quickly developed what I later learned is called capsular contracture. It's where the scar tissue around your implant, tightens up. So for me, On the side I was irradiated, that really rose up. So I was kind of lopsided. When I went back to my plastic surgeon, he said, well, we couldn't predict that. That's just how your body responded to radiation. But years later, once I started my own research, I discovered that that's not actually true. So when you are reconstructed and you've gone through radiation, that's actually extremely common. Like more times than not, the patient will develop capsular contracture. So that was frustrating because I know all those years I kind of, would see my lopsided breasts and go, oh shit, I didn't do radiation good,
Mm-hmm.
And I just kind of carried that. So, learning later, hey, you know what? It's not really recommended because that usually happens. And then I started learning a lot about breast implants as medical devices, getting into the history, going back all the way to, the early 90s and before that, about how faulty breast implants are, and, that nothing's changed with them and that those problems continue, led me to decide, no, I'm not going to get new ones. I'm just not going to do that. So then I spent several months researching the other flat procedures, namely one called DEEP, which is like the second one that the doctors will recommend. It's either implants or DEEP. Usually, if you don't have enough extra fat, they'll suggest implants. When I was first diagnosed, I didn't have that extra fat, so that was my option. But again, I think, what I've seen is when they do recommend DEEP, it's kind of like, yeah, you're going to get a tummy tuck, you're going to get new breasts, they're going to be your own flesh, so they're going to feel warm and natural. And it's just this beautiful picture of how it's going to go. And then I joined a group for women going through that surgery, and it's just horrific, from my personal view, when I witnessed, women going through their surgery and their posts and their issues healing, learning more about the surgery itself, what actually takes place. I just came to the conclusion after agonizing. I mean, it wasn't just like, oh, I just want to be flat. That wasn't something that I went in knowing. But as I, saw that other option, I just realized no. And I started to get really angry, I think, as I saw what women were going through. And I think that really fueled my fire for some reason, that particular surgery, just how invasive it is, and that it's all done in the name of creating new breast mounds that really don't look like breasts for the most part. And that generally the women, they're not going to feel like breasts, maybe to someone else touching them, but for the woman herself, they're not going to have those same sensations as they had with their natural breasts. So just to see how much people were going through and suffering, really, it just made me really impassioned toward kind of the flat movement and promoting flat. So I decided to start my support group, namely with the goal of finding women who were learning about breast implant illness and were going to be moving toward removing their implants. So that was kind of the impetus for my group, was to find those women, because in the other groups, it was mostly made up of women who were augmented just by choice. So it was very hard for me as a survivor who would have no breasts when I get my implants out to really relate to women, agonizing over getting their implants out, and maybe, oh, look, I'm so flat. And as a survivor, you just, want to say, what? I'll show you what flat looks like. So I just wanted to create that safe space for survivors who were making that choice to have their implants out and who would be totally flat, that they could just find solace in a group of other women who know their experience, who've been through their experience. And on a second note, to also find women who were just being diagnosed, and just to get them to gain all this knowledge ahead of time before ever beginning to go through reconstruction, just so they could bypass, all those surgeries, all that wasted time, different unexplained illnesses that no one can understand what's going wrong. So just to kind of reach them before they ever got there was kind of my secondary goal. And, over the past 2.5 years since I founded the group, I found that now, more than half are people who went straight to flat or are doing that. So that's been really surprising. I thought that the majority were still women who were reconstructed, who are, moving toward getting explanted. But now it's, almost 50-50 of, newly diagnosed women who are hearing about flat. It's a movement that's really made great strides in the past couple years and becoming more well-known, thanks to many great advocates that we have, promoting flat visibility and getting that option seen and known. Because, historically, it's, well, not, going back many years into like the 70s or 80s, but definitely in the past 20 years or so, or even, 30 years, reconstruction has really been, the normal thing to do, just without question. And even from the practitioners arena, as far as what they're offering, it's really uncommon that flat would be offered. We're seeing it more now, it being mentioned, but by and large, it's still not really presented as a choice. It's just those surgeries I mentioned, the implants or deep or one of the other flaps are really what's presented.
So I got to ask, you got to tell us about this TikTok video that went viral.
Okay, so this TikTok video was at a breast cancer event a few weeks ago in Palm Springs, California. It was a part of a campaign started by Renee Ridgely and Stacy Sigmund, who are two advocates. It's called Stand Tall AFC, and the goal of the campaign was to get women to show up at breast cancer events, even plastic surgery races. There's one coming up in Atlanta, but to show up presenting flat as a choice and presenting themselves, making themselves visible. So I went down to be part of that campaign in Palm Springs, and as the, it wasn't really a race, it was a walk, but as the walk, got going, we just felt inspired to take our shirts off and, let our chest be seen. A lot of us had either fake tattoos or some people had been tattooed previously, and some just went with their bare chest, just clear and clean. And we had been practicing a dance because we were at a retreat, a flat retreat it was called. So we've been practicing a dance that one of the attendees made up. Jessica Pierce is her name. Okay. And we learned the dance. So when we were walking in the event, we just, someone got the music going, and there was, maybe close to 10 of us that stopped and performed the dance that we learned. And one of the attendees, Terry Kincaid, is really big into TikTok. So she posted it. And, within a few days, we had 500,000 views. Wow. Just in the past couple days, I found out that it's over 3 million views now. Yeah, so it's really amazing. It's just a short little minute or so of us doing our moves. We're all topless, and we're just doing our moves to this song. So it's, pretty amazing that that many people have been drawn to it or watched it, shared it. So that's definitely, making flat visible. So people are seeing it, people are learning it exists and that it's a choice. So So, like I said, we're making a lot of strides, and that's just continuing. You'll notice the International Flat Day sign behind me.
Yes.
And that's on October 7th. So it just passed a few weeks ago. But that's a day I founded in 2019. I co-founded that with a fellow breast implant illness advocate and survivor. And so this year we just celebrated the third one, but it's also growing and more women are hearing about it. So it's been really great to just see, kind of the movement progressing and growing at the pace that it is.
No, I love that about you. You're like this movement leader. You're just taking charge with everybody else around you. And I love that. We need change and powerful people like yourself to make that happen. And it's amazing. I got a picture here that you sent me, and I want you to tell me what was this about, but I wanted to bring it up. Was this a photo shoot or what? I love the hair. I have to give you props on this. So tell us a little bit about this picture and what's behind it.
Okay, so this picture in particular, this was right after I finished chemo the second time. It was just a few weeks after finishing. And it was actually a cousin of mine who just wanted to do something nice. And she also cuts hair. Mm-hmm. So my hair was all crazy, and I kind of had refused to cut it after chemo because it wasn't falling out. So I just wanted to see how long it was going to last. And then I just ended up having like this Einstein. I called myself Albert Einstein is how it looked. So she's like, let's just cut it. It's going to look great. You'll like it. And it had grown back gray, which I'd actually been trying to grow out my gray for a couple years. So I guess it took chemo just
I think we all are.
to fast forward me into gray. But, and one thing is this cousin, she's actually the person that turned me on to breast implant illness. So when I went to get my haircut, I actually disclosed to her, because I guess that's one of the things you tell your hairdresser, that you're going to get new fake boobs. But she was the first person I mentioned, hey, I'm going to go for my revision. And she said, hey, have you heard of breast implant illness? And I said, no, I've never heard of that in my life. And so she added me to one of the Facebook support groups, Breast Implant Illness and Healing by Nicole. So when I got home from the appointment, I saw that I had been added to that group. And that's really where my journey toward Xplant, founding my group, International Flat Day, all of this stuff began, that day when I was added to that breast implant illness group. So this cousin is the same one that wanted to do my little photo shoot with my chemo gray short hair. And that's what that picture is all about.
I love it. Isn't it amazing how little things develop into big things overnight? And it's amazing how we all connect on certain things. I tell you what, Christy, I got to throw this out. What is going on with you now? I mean, you have so much going on. Anything exciting you want to tell everybody, or in the future that's going on with you or your movement?
I think there's a lot going on with other people. So just trying to figure out how I can support and, prop up other advocates who are kind of, I don't think it's just my lead, like you mentioned, being a leader. I recognize, my part in the community and the ways I'm trying to grow the movement, but there's so many people doing that. And, I was just, a little gal at one point, looking up to other advocates and jumping on board. And when I see new people that are going through kind of having that fire that I had through their own experience, whether that's through getting their implants out or, being really pressed by their doctors to get reconstructed when they're clearly saying they don't want to. And that, fueling fires that I'm just trying to help through my group, promote what they're doing, encourage them to, start their own ideas, their own movements, whatever they may be. So I think a lot of that's happening. So I'm just kind of trying to figure out ways that I can kind of prop other maybe newcomers, I'll call it, to the movement, how I can prop them up and help advocate for them to, be successful in their goal of, furthering knowledge about breast implants, furthering knowledge about the flat option, and just all the good that we're trying to get done.
Wow, you are a wealth of knowledge here. One more thing before we wrap things up, I want you to tell anybody that just recently got diagnosed, what would you tell them? Look them in the camera and say, what would you give, any kind of words of wisdom or advice to just help them out?
I would say get a counselor. Having someone to talk to. We go through so much, and I think we think, oh, I can do it. It's so helpful to have, a professional who can help you work through your emotions, and all the difficult things that you'll go through along the way, that maybe you can't express to your friends and family, even though, we want to lean on those people for support, and you can, but there's a lot that, they're not trained to understand. And it's just really important, I think, for people to have that outlet to, share their feelings, share their struggles, and all that they're going through, because we have a tendency to really want to be strong for our friends and family. So to have that safe space that you can really let down and, get advice, learn how to deal with some of the feelings that you have. That would be part of my suggestion. Another big thing I would say is definitely, if you're newly diagnosed, to research reconstruction options. Don't just blindly follow through with what you're being told. Definitely visit the FDA website on breast implants and do your research there. If you think you're going that route, it's really important that you're informed if you're making that choice. And also the deep surgery, don't just take it as a tummy tuck and new boobs and that you're going to be on your way. Again, join those support groups for that particular surgery online. There's a deep support group, spend time in there, see what it involves, see what women go through before you just, blindly jump in. And, flat groups as well. My group is open to women exploring that option. So if you don't know what you're going to do and this flat option piques your interest, you're welcome to join Fierce Flat Forward and, see what it's all about, see what women have experienced and how they're doing living the flat life, we call it. So definitely learn your options. And get a counselor. I guess those are my two top recommendations.
There it is. Well, hey, Christy, thank you so much for taking time out of your day and being part of our family for Think Pink Tuesday. You're coming back next year, right? For sure?
Oh, sure. Yeah, I would love to.
Yes, you're already booked.
And thank you so much for having me. I hope next year I have even greater, exciting things to tell you about.
I hope we go, instead of just going for 8 hours, I hope we go for 24 hours next year. So that's our goal. Just keep it going. But
awesome.
Again, thank you so much for what you're doing. God bless you. And I'll talk to you soon. And everybody else out there, get ready. We have another aspiring guest coming up very, very soon. Take care.
Thanks, Richard.
You're welcome.